Hi, I'm Corey with Ried Physical Therapy. I'm here to tell you a little bit about elbow bursitis. So first, let's go over what a bursa is. A bursa is a tiny fluid-filled sac that exists around our joints and really all over our body, anywhere we have potentially rubbing or it's a shallow kind of area that can need a little cushion. So these little fluid-filled sacs allow gliding of tendons and ligaments over bone and gliding of structures on one another within our body, which allows for us to have a friction-free environment at our moving parts. So a bursitis is an inflammation of one of these things that can be caused by a couple different things. Trauma, so a direct blow a lot of times in the elbow, it can be related to a fall onto the elbow where you get a bang through that elbow, specifically right along kind of the elbow bone here. And that pain can cause inflammation and vice versa. That inflammation can cause pain as well. So either that or an overuse injury can cause it too. Some repetitive movements can cause that bursa to fire up and become swollen without having an impact. Or an infection, which is known as septic bursitis, can happen, especially at the elbow. People who are prone to infections and have conditions that make them more likely to get an infection should keep an eye out for this kind of thing when you have that swelling, gnarly swelling without any kind of known cause. A lot of times it's a good time to get screened for infection. Without an infection, a lot of times these things can get better with proper kind of healing, proper kind of therapy. So the symptoms of a bursitis can be swelling, redness, and pain around the area where a bursa would exist. And what we do in physical therapy to try to help with these bursitis at the elbow is improve the mechanics of the elbow, make sure that the bursitis isn't accepting a lot of trauma by movement correction, improve motion flexibility and strength around the joint where that bursa has become inflamed, and help improve the different qualities of movement, power, agility, endurance around a joint that can allow for a healing environment where we're going to reduce stress at that bursa and allow it to heal up so that you can have less pain with your desired activities, whether that be just normal daily activities or sport performance. And a lot of times physical therapy is the best option for this and can really help you get back to doing what you like doing a little bit quicker.